Hi everyone, happy Wednesday. Today we're going to be talking about Black Hair Health and the Crown Act with Whitman-Walker Health. Just going to give it a few seconds for folks to join. Get my Whitman-Walker folks in the room. I hope everyone's having a super beautiful Wednesday. What's up, Deuce Jones? How are you? Hope you're doing well.
Good, how are you?
I'm good. Happy Wednesday. Awesome. Welcome, everyone. We'll get started now. Happy Wednesday again. During the COVID-19 pandemic, the Whitman-Walker's Community Health Department has expanded its social media outreach to include, just going to rewind back. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STI and sexual health practices, to access to care, to social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, her pronouns, and I work on the community health team to help bring these weekly educations via social media and Instagram Live with my colleague Corey as well. And today we're going to be discussing Black women's hair health and tips on keeping your hair healthy and thriving. But a little bit of review from last week first. We talked about Black hair and Black women's hair experiences. I was joined by 8 other wonderful Black women who came on and shared kind of what their experiences growing up with their hair was like, what going through school and different folks who they relied to get their hair done for them was like, and how people described their hair, both positively and negatively, and kind of what their journey was to kind of fall in love with their hair. So we also talked about a few facts around hair health. So we learned that in September 2014, the Journal of Clinical and Aesthetic Dermatology published a study article titled African American Women, Hair Care and Health Barriers. And it was by Dr. Rochelle Cochran Gathers and Meredith Grace Mahan. A qualitative survey of 200 African American women ages 21 to 83 concluded that hair loss affects a compelling number of African American women, and a significant number expressed dissatisfaction in hair-related physician encounters. So when they go to the doctor, they're not really getting the help that they need or thought that they would be getting when they go to kind of learn about what their hair loss and hair health is looking like. And additionally, hairstyling problems present a serious impediment to physical activity and weight management among this already high-risk population. We also learned that while hair loss among African American women is exceedingly common, there's limited epidemiological data to address this. And it's also and alopecia is the 4th most common diagnosis of African Americans presenting to the dermatologist and accounting for 8.3% of their visits each year. More than half of African American women will cite thinning hair and hair loss as their top hair concern. So it's a thing that affects a lot of us. I want to take a little bit of time to acknowledge some amazing work that's been happening around the Crown Act of 2022. For years and years and generations, Black people and Black hair and any kind of textured hair has been policed, and people are putting their thoughts and guides and policies and laws around how people show up with their hair in workspaces or school settings, and there's a lot of hair discrimination that people experience. So the Crown Act of 2022 stands for Creating a Respectful and Open World for Natural Hair Act of 2022, and it works to prohibit discrimination based on an individual's texture or style of hair. Again, many Black adults and children face hair discrimination in their everyday lives. So whether it occurs in the uniform guidelines in an institution like a school or the military, or it results in a loss of a job opportunity or position, this form of hair discrimination can be more discreet. So thanks to the Crown Act of 2022 that has recently passed the House, there may be a law in place to protect people with textured hair and allow us to style our hairs in ways that we see fit and that please us and our hairstyle goals. That said, last week we did have on a few people who talked about their different hair experiences, and we heard from 9 different Black women about their experiences with their hair care and learning to be responsible for their hair and what that journey was like. And a few of the common themes that we heard included taking full responsibility for their hair in their late teen years, so like high school time or maybe going off to college time. But it wasn't until those late teen years that people really started to be responsible for their hair. Another commonality that we saw was that people did a lot of of big chops during college. Like that was a sweet spot for people to kind of restart their hair journey or figure out what their next chapter of their hair journey looked like. And a lot of that resulted in having to start off with a big chop to get rid of any hair that wasn't as healthy as it could be. We also saw a lot of folks who didn't start to see the beauty of their hair until it was in its natural state. After years of growing up in a space or cultural moment where a lot of what we were seeing was calling for straighter hair or more or Eurocentric hair. A lot of us grew up either flat ironing our hair a lot or getting a weave or tracks or getting braids. And I mean, I grew up on braids. I also lived in the hair braiding shop, but just we all had very different ways of kind of keeping up with our hair and learning how to take care of it. And so after all of those years of kind of these different outlets of keeping our hair going and keeping our hair maintained, if you will, people really started to embrace their hair and the beauty that it held when they kind of did their big chop and started to wear their hair naturally. We also saw a lot of folks who had experiences of people using demeaning words and jokes to describe their hair. I know I had a friend who talked about someone calling her hair strong, but not meaning it in a way that's, pleasant and complimentary. They more so were like, your hair's too strong for this comb and this brush. But people who had a lot of experiences with someone who was commenting on their hair and, it was uncalled for and not in a positive way and wasn't respectful to their hair and experience. And yeah, finally we learned about people who, in that time before they took the responsibility of their hair when they became a teenager, we learned who was taking care of their hair before that. So we had folks who, again, like lived in hair braiding shops. We had folks who had to look to a loved one, like a mother or an aunt or a sister who did their hair or had some other kind of form of hairstylist, if you will. So those were a few of the different things that we learned about Black women and their hair experiences. In the interest of autonomy over your hairstyles and care, I want to share a few tips on keeping your hair healthy and thriving. So this is according to dermatologist. More than half of African American women will cite thinning hair or hair loss as their top hair concern. But other types of hair loss, including generalized hair shedding, can be brought on by stress and a poor diet. You should do your best to eat a balanced diet and find ways to take care of your mental health. Fortunately, there's a lot you can do to help minimize damage and keep your hair beautiful. So to keep Black hair healthy, dermatologists recommend the following tips. Wash your hair once a week or every other week. This will help prevent buildup of hair care products, which can be drying to the hair. Number 2, use conditioner. Use conditioner every time you wash your hair. Be sure to coat the ends of your hair with conditioner as the ends are the oldest and most fragile parts of your hair. Use a hot oil treatment twice a month. This adds additional moisture and elasticity to your hair. Use a heat protecting product before styling your hair. Adding this to wet hair before styling will help minimize heat damage. Use a heat protecting product before styling. Oh, I already did that one. Use caution with relaxers. To minimize hair damage, always go to a professional hair stylist to ensure that the relaxer is applied safely. Touch-ups should only be done every 2 to 3 months and only to newly grown hair. Never apply relaxer to hair that has already been relaxed. This is something that, as a person who got perms for a long time, I didn't even know was a thing. Not that I was trying to do my perms at home by myself, but to read these words and really understand like the significance of not literally burning your hair off chemically because you applied relaxer to already permed hair is wild. That we're putting it on our scalps and at such young ages. Next, you want to use ceramic combs or irons to press your hair. If you'd like to press or thermally straighten your hair, use a ceramic comb or iron and only do so once a week. Using a straightening device with a dial to ensure that the device is not too hot is ideal. And you want to use the lowest possible temperature setting that gives you the style that you want. And a higher temperature may be necessary for thicker and coarser hair, but kind of start at the bottom in terms of temperatures and work your way up until you're safely and not using the highest setting, getting your hair to the style that you want to be at. Finally, make sure braids, cornrows, or weaves are not too tight. If it hurts while your hair is being styled, ask the stylist to stop and redo it. Pain equals damage. I know that I've very much let people braid things into my hair and it be the most tight, like hold your head, can't laugh for a couple of days tight, can't smile too hard for a couple of days tight. And I never once thought to say, hey, can you please redo this so I can emote with my face? So definitely ask folks to stop and redo it. According to an article by dermatologist Dr. Crystal Agu on hopkinsmedicine.org, certain types of hair loss are genetic and very little can be done to prevent them. Genetic types of hair loss include alopecia areata and female pattern hair loss. She also shares that these tips help avoid hair loss, especially if you're experiencing traction alopecia. If you have braids, remove them after 3 months. If you wear a weave or hair extensions, remove them after 8 weeks. If you have relaxed or dyed hair, make sure these treatments are applied by a professional. If you still notice breakage or hair shedding, avoid chemical treatments completely. For added benefit, you want to stay up to date on your routine healthcare checkups. Anemia, low levels of vitamin D, and abnormal thyroid hormones can all affect the health of your hair. Simple blood work from your primary care physician can determine if these conditions are contributing to your hair loss. And the better and sooner you catch it, the more effective it can be in terms of your treatment plan. So thank you all for sitting and listening to a little bit more about Black hair health and learning about the Crown Act and stopping Black hair and textured hair discrimination. And I hope you all have a wonderful rest of your Wednesday. But of course, before we go, we're still living in COVID-19 land. So we want to share some information about the COVID-19 vaccines. If you've already been vaccinated, congratulations. You've taken a really big, important step to helping prevent your loved ones, yourself, and your community from getting sick. Multiple variants are always on the rise and spreading and whatnot. So it's important to remember that the vaccine isn't 100% effective at preventing new cases of COVID-19, but it is effective at helping preventing you from getting super sick with COVID, from being hospitalized with COVID, or from dying of COVID. So just be alert. If you feel like you still want to wear your mask, that's totally cool. Just follow CDC guidelines and keep up to date on what they're recommending that we do. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 12 and up is eligible to receive a Pfizer COVID-19 vaccine, and everyone ages 12 and up is able to receive a COVID-19 vaccine, period. Please reach out to us at 202-207-2480. Again, that's 202-207-2480 to make an appointment for a COVID-19 vaccine. And if you're having trouble making an appointment with us, if you're a DC resident, call 1-855-363-0333 or visit vaccinate.dc.gov. Again, vaccinate.dc.gov and 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. Again, that's vaccinate.virginia.gov or 1-877-829-4682. Finally, if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting a COVID-19 vaccine and discuss COVID-19 precautionary measures with those who are around you, and be mindful of masks and keeping your distance, but especially if you do not know if the person that you're with or that you're hanging out with is vaccinated or not. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website, www.whitman-walker.org, for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Again, that's 202-797-4439. You can use that same phone number to schedule an HIV or an STI testing appointment. So definitely give us a call. April is National STD Awareness Month, so definitely a great month to get tested if you haven't already done so this year. And please follow our family programs at Real Talk DC _ and at No Filter DC. Have a wonderful rest of your day.